Hello, my name is Angela Barry, and along with Emily Stapleton and Ashton Olsen, we will today be talking about the drug Diltiazem. We are group number 4, and we hope that you are able to learn a new fact or two about this drug. Indications. The drug we have chosen is Diltiazem. It is a calcium channel blocker used to treat hypertension by lowering blood pressure and managing chronic stable angina or pressure caused by heart disease. A calcium channel blocker is an antihypertensive that stops calcium from entering the heart muscle cells. As calcium is the main contributor in helping the blood vessels and heart muscles squeeze, the blocking of calcium allows these blood vessels to open up and relax, lowering the blood pressure. Diltiazem is a non-dihydropyridine type of calcium channel blocker and is mainly used to treat angina, whilst other types of calcium channel blockers are primarily used to treat hypertension. Class 4 agents affect calcium channels and the AV node. These drugs inhibit the L-type calcium channels, which are responsible for the influx of calcium ions during the plateau phase of the action potential. They shorten phase 2 of the action potential, reduce contractility, and they may be unsuitable for heart failure. They also decrease conduction velocity and prolong repolarization, especially at the atrioventricular node. In contrast to beta blockers, Class 4 allows the body to retain adrenergic control of the heart rate and contractility. Conditions that are indicated for the use of oral diltiazem include the management of hypertension, as it helps lower the blood pressure by blocking the calcium to the blood vessels, allowing for them to relax and widen, decreasing blood pressure. Another indication for oral diltiazem is patients who are diagnosed with stable chronic angina. It helps improve stable angina as the calcium channel blocker primarily decreases the myocardial oxygen consumption, allowing for improvement in exercise tolerance and reduces the onset of angina. Intravenous diltiazem is indicated short-term management, especially when a patient has an atrial fibrillation or atrial flutter for temporary control of rapid ventricular rate. Another instance that intravenous diltiazem is indicated for is paroxysmal supraventricular tachycardias, PSVT, to rapidly change back to a sinus rhythm. Appearance. Diltiazem comes in 4 different sizes of oral tablets, which include 30 mg, 60 mg, 90 mg, and 120 mg. The 30 mg tablet should not be split. A patient swallowing an extended release tablet or extended release capsule should swallow the tablet whole on an empty stomach, as food interferes with how the diltiazem tablet is absorbed into the body and released. Another appearance that diltiazem can take is fluid in a vial, which would be 25 mg in 5 ml, which can only be injected intravenously.
Hello, my name is Emily Stapleton, and I'll be talking about the contraindications and precautions of taking diltiazem. There are multiple benefits of taking diltiazem, but if taken when presenting these symptoms, can have a bad effect on the body. For example, diltiazem should not be taken and avoided if the patient has any of these symptoms. If the patient has a low blood pressure because of the mechanism of diltiazem, it widens the blood vessels, leading to a drop in blood pressure. A patient who has a serious heart condition such as sick sinus syndrome should avoid diltiazem. This is because sick sinus syndrome suppresses the sinoatrial node, which is already dysfunctional in SSS, causing the patient to go in severe bradycardia. Diltiazem given to a patient who has sick sinus syndrome can lead to an AV block, as diltiazem shows the electrical signals between the atrial and the ventricles, making the AV block worse. If a patient mentioned that showing any signs of a recent heart attack with the fluid buildup in the lungs, then diltiazem should be avoided, since diltiazem can make it harder for the heart to pump blood effectively due to the heart already being weak. Acute myocardial infarction and pulmonary congestion worsens heart contractions and increases chances of blockage if the patient takes diltiazem. Alcohol is linked to an adverse response that are dose-related and increase the pace and degree and exposure of diltiazem. Controlled release formulation. Hence, why alcohol should be avoided, as it speeds up at the rate which diltiazem is absorbed by the patient. As has an alcohol prior, then diltiazem treatment should not happen. Unless prescribed and discussed accordingly, patients should avoid taking other medications with diltiazem. In order to ensure diltiazem is the best calcium channel blocker for your body, it is important to take into consideration the precautions to ensure life quality. There is multiple precautions that are put into place for diltiazem. Dizziness and lightheadedness is a precaution due to the widened blood vessels, as it drops blood pressure and can cause the patient to feel dizzy or lightheaded. Although decreased blood pressure is intended for using diltiazem, the excessive and quick drop in blood pressure can lead to syncope. If the patient faints, about to faint, is feeling lightheaded or dizzy, then the best course of action is to lie them down or have them in a sitting position to prevent the patient from fainting and their symptoms from worsening. Stevens-Johnson syndrome and atoxic endoepidermal necrosis are serious skin conditions that should be taken into precaution when taking diltiazem. The signs of these serious skin reactions are blistering, peeling, itching, and a skin rash. Constipation is a precaution because diltiazem blocks the CC, or the calcium channels, in the smooth blood vessels and gastrointestinal tract. Due to the calcium channel blockers, contraction is limited in the gastrointestinal tract.
Hi, my name is Ashton Olsen, and today I will be talking to you about the side effects when taking diltiazem. Although diltiazem is used to treat hypertension and stable angina, it can also cause some serious side effects and health risk. Some side effects of diltiazem require medical attention, but the side effects that are likely to go away as the patient's body adjusts to treatment are sneezing, a stuffy nose, a rash, and swollen joints. However, if these minor symptoms continue, then the patient will likely need immediate medical attention. The common side effects of a patient who has been treated with diltiazem that will need medical attention are as described. A patient may report with body aches and pain, and excessive body fluid accumulation like mucus. The patient may also have dryness or soreness of the throat, as the salivary glands do not produce enough saliva. The other side effects from taking diltiazem is a fever from the increased body temperature, and hoarseness or dysphonia, which causes abnormal changes in the voice. The remaining side effects from using diltiazem are a runny nose, swollen glands in the neck, and the patient having trouble with swallowing. Although there are multiple side effects, the most common for diltiazem is edema, headaches, and dizziness. Moreover, there are up to 15% of people that reported having peripheral edema as a side effect due to taking diltiazem. As stated before, the side effects of diltiazem occur because diltiazem works to inhibit the influx of extracellular calcium ions into a process that eventually leads to lower blood pressure, slower conduction in the sinoatrial and atrioventricular nodes, and reduced contractility in isolated cardiac tissues. The lowered blood pressure is one of the reasons behind headaches, body pain, and hoarseness of the throat. Slower conduction of the atrioventricular and sinoatrial nodes results in a decreased heart rate that may lead to chest pain. When the patient takes diltiazem, they will have a decreased heart rate or may be bradycardic, in the chance that any contradiction is ignored, specifically if the person already has a lowered heart rate. However, a lower blood pressure is an important side effect of diltiazem because it is working to treat atrial fibrillation. A patient with atrial fibrillation will have tachycardia, so the side effect of a slower heart rate is expected. Hypertension is one of the causes for atrial fibrillation, so the process of lowering blood pressure may cause headaches and body pain, but it is necessary for the patient's treatment. Diltiazem's side effects may cause other issues for the patient, but they help prevent any cardiac diseases that a patient might be at risk of getting. Thank you for listening and have a great day.